Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Joshua. My name is Rachel, and I am the podiatrist. How can I help you today?
Good morning, Rachel. I've been experiencing pain and discomfort in my left foot for the past few months, and I wanted to see if you could help me with it.
Of course, Joshua. Can you tell me a bit more about your symptoms? When did you first notice the pain?
I first noticed the pain about 3 months ago. It was occasional and mild at first, but it gradually became more frequent and severe.
I see. And what does the pain feel like?
It's a dull ache that's worse when I first wake up in the morning and after prolonged standing or walking. But it improves when I sit down or elevate my foot.
All right, and have you noticed any other symptoms?
Not really, just the pain in my foot.
Can you tell me a bit about your occupation and how this pain has affected your daily activities?
I'm a construction worker, and the pain has made it difficult for me to perform my job. I've also been unable to participate in my usual leisure activities, such as playing sports and going for walks.
I understand. Have you been referred by any other healthcare professional for your foot pain?
No, I haven't.
And have you been previously diagnosed with any condition related to your foot pain?
No, I haven't.
All right, and what kind of treatment have you been trying so far?
I've been taking over-the-counter pain medication and trying to rest my foot as much as possible.
All right, well, after examination, I diagnose you with plantar fasciitis. I recommend that you continue taking over-the-counter pain medication and wear orthotics in your shoes. I also suggest physical therapy to strengthen the muscles in your foot and ankle and to improve flexibility in the affected area. I advise you to avoid activities that make your symptoms worse, such as prolonged standing or walking on hard surfaces. And I will schedule a follow-up appointment in 2 weeks to reassess your condition and make any necessary adjustments to your treatment plan.
Thank you, Rachel. I appreciate your help.
My pleasure, Joshua. Let me know if you have any other questions or concerns.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Taylor. My name is Dr. Isaiah. I am the doctor in charge of your son's case. Can you tell me a bit about Taylor's information?
Of course, Dr. Isaiah. Taylor is 12 years old and he lives with us at 12 Oxford Street, London, in a house in a suburban area.
Thank you. Can you tell me about his closest relatives?
Sure, I'm his mother, Sarah. I'm a stay-at-home mom. His father, John, works as a software engineer. Taylor has an older sister named Rachel, who works as a teacher.
I see. Can you tell me the reason why Taylor is presenting to the hospital?
Taylor presented with a mass in his right thigh, suspected to be a tumor.
I understand. Can you tell me about his past medical history and any family history of illness?
Taylor has no past medical history, and there is no family history of illness.
What is his social history?
Taylor is an active child who enjoys playing soccer and swimming. He is currently in 6th grade and does well in school.
Does he have any allergies?
Yes, Taylor is allergic to peanuts.
Can you tell me about his dietary habits?
Taylor's diet is primarily composed of a mix of fruits, vegetables, and lean protein.
Was he on any medications before admission?
No, he was not on any medications before admission.
I see. The vital signs we took were blood pressure of 120 over 80 millimeters of mercury, heart rate of 80 bpm, respiratory rate of 14 breaths per minute, and temperature of 98.6 F. Our assessment revealed a mass in his right thigh, measuring approximately 3 centimeters in diameter. The mass is firm and non-tender to palpation. We have diagnosed him with rhabdomyosarcoma. We conducted imaging studies such as MRI and CT scan to confirm the diagnosis.
Oh my goodness, that sounds serious.
Yes, it is a serious condition. However, we will be starting Taylor on a course of chemotherapy and radiation therapy. We will be closely monitoring his vital signs, as well as any potential side effects from treatment.
What is the discharge plan?
Taylor will continue to receive treatment on an outpatient basis, with regular follow-up appointments to monitor progress and adjust treatment as needed. We will also be referring him to a pediatric oncologist for further management.
Thank you, Dr. Isaiah. I appreciate all the information you have provided.
Of course, Mrs. Taylor. We will do everything in our power to help Taylor through this difficult time.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a dietitian talking to a patient about a new treatment plan. Now read the question.
Good morning. How are you feeling today?
I'm feeling okay, thanks.
That's great to hear. I wanted to talk to you about a new treatment plan that I think could help with your condition.
Sure, I'm open to trying anything at this point.
Excellent. Based on your test results and medical history, I recommend a plant-based diet. Studies have shown that a diet high in fruits, vegetables, whole grains, and legumes can help lower the risk of heart disease, obesity, and type 2 diabetes.
I've never really considered a plant-based diet before. What kind of foods would I be eating?
You'll be eating a variety of fruits, vegetables, whole grains, and legumes. Some examples include leafy greens, berries, whole wheat bread, quinoa, lentils, and beans. You'll also want to limit your intake of animal products, processed foods, and added sugars.
That sounds doable. Are there any supplements or vitamins I need to take on this diet?
It's a good idea to make sure you are getting enough vitamin B12, which is primarily found in animal products. You can take a supplement or eat foods that are fortified with B12. Additionally, it would be beneficial to take vitamin D, iron, and omega-3 supplements as well.
All right, that makes sense. Is there anything else I should know about this treatment plan?
I recommend checking in with me regularly to monitor your progress and make any necessary adjustments to your diet. Additionally, you may want to consider incorporating physical activity into your daily routine, as it can improve your overall health and well-being.
Got it. I'm ready to give this a try.
Great. I'm confident that this treatment plan will help you improve your condition and overall health. Let's schedule a follow-up appointment in a month to check on your progress and answer any questions you may have.
Sounds good. Thank you for your help.
You're welcome. Remember, making lifestyle changes can be challenging, but with dedication and support, you can achieve your health goals.
Now look at question 26. You hear a doctor talking to a patient experiencing a condition called fibromyalgia. Now read the question.
Good morning, how are you feeling today?
Not great. I've been experiencing some symptoms that I'm concerned about.
I understand. Can you tell me a bit more about what's been going on?
Well, for the past few weeks I've been experiencing a lot of fatigue, headaches, and I've been having trouble sleeping.
I see. Based on your symptoms, I believe you may be experiencing a condition called fibromyalgia. It's a condition characterized by widespread muscle pain and tenderness, as well as fatigue and difficulty sleeping.
That sounds like what I've been experiencing. What causes it?
The exact cause of fibromyalgia is not known, but it's thought to be related to a combination of genetic and environmental factors. It's also often seen in people who have had a traumatic event or have been through a lot of stress.
Is there a cure for it?
Unfortunately, there is no cure for fibromyalgia. However, there are many treatment options available that can help manage the symptoms. These include medications, physical therapy, and lifestyle changes.
What kind of medications do you recommend?
I recommend starting with a medication called pregabalin. It's an anticonvulsant that has been shown to be effective in reducing pain and improving sleep in people with fibromyalgia. Additionally, we can try duloxetine. It is an antidepressant, which has been found to be effective in reducing fibromyalgia pain.
Are there any lifestyle changes I should make?
Yes, I recommend incorporating regular physical activity into your daily routine, as well as practicing stress-reducing techniques such as yoga or meditation. It's also important to get enough sleep and to avoid smoking and excessive alcohol consumption.
All right, I'm willing to try anything to feel better.
Great. I'll write you a prescription for pregabalin, and we can schedule a follow-up appointment in a month to check on your progress and adjust your treatment plan if necessary.
Thank you, doctor.
You're welcome. Remember, managing fibromyalgia can be a process, and it may take some time to find the right treatment plan for you. But with the right combination of medications and lifestyle changes, you can improve your symptoms and quality of life.
Now look at question 27. You hear a nurse briefing colleague about a patient with complaints of chest pain. Now read the question. Hey, can I give you a quick briefing on our new patient in room 3?
Sure, go ahead.
Her name is Jane Smith. She's a 55-year-old female who was brought in with complaints of chest pain. We've run some tests, and it looks like she's having a heart attack. We've started her on some medication, and she's currently in the cardiac catheterization lab.
Okay, thanks for letting me know. Is there anything else I should be aware of?
She has a history of hypertension and high cholesterol. Also, she's diabetic and is currently on insulin. Make sure to monitor her glucose levels closely. Oh, and one more thing, she's allergic to penicillin, so make sure to avoid any medications that contain it.
Got it. Thanks for the update. I'll take care of her.
Great, let me know if you need any help. Now look at question 28. You hear two healthcare radiologists talking about digital tomosynthesis. Now read the question.
Hey, have you heard about the new technology that's being developed for radiography?
No, I haven't. Tell me more about it.
It's called the digital tomosynthesis. It's a new imaging technique that creates a three-dimensional image of the body using X-rays. It's supposed to be more accurate and efficient than traditional X-ray techniques.
Wow, that sounds like a game changer. How does it work exactly?
It uses a low dose of radiation and takes multiple X-ray images of the body at different angles. These images are then combined to create a 3D image of the area being examined. It's especially useful for detecting small tumors or abnormalities that might be missed by traditional X-ray techniques.
That's amazing. I can see how this technology could revolutionize radiography. Do you know when it's going to be available for use in clinics?
I have heard it's already being used in some clinics, but it's still in the early stages of development. I think it will take a couple of more years before it becomes widely available.
I can't wait to see it in action. Thanks for letting me know about this new technology.
Of course, it's always good to stay informed about new developments in our field.
Now look at question 29. You hear a chiropractor briefing a colleague about a patient experiencing lower back pain. Now read the question.
Hey, can I give you a quick briefing on our new patient in room 2?
Sure, go ahead.
Her name is Sarah Johnson. She's a 32-year-old female who has been experiencing lower back pain for a few weeks. She's been experiencing difficulty in standing and sitting for long periods of time. After examination, it looks like her pain is caused by a herniated disc. We've started her on a treatment plan that includes spinal manipulation and exercises to strengthen the muscles in her back.
Okay, thanks for letting me know. Is there anything else I should be aware of?
She has a history of scoliosis and is a bit sensitive to pressure on her lower back. Make sure to go easy on her during her manipulation. Also, she's currently taking ibuprofen for pain management. We will be monitoring her progress closely, but so far she's responding well to the treatment.
Got it. Thanks for the update. I'll take care of her.
Great, let me know if you need any help.
Now look at question 30. You hear a surgeon discussing about a patient who underwent knee replacement surgery, with a nurse in the recovery ward. Now read the question.
Good morning, nurse. I wanted to give you a quick update on our patient in room 5. His name is Michael Smith.
Good morning, doctor. Yes, I remember him. He had a knee replacement surgery yesterday.
That's correct. The surgery went well, and he's recovering nicely. He's still experiencing some pain and discomfort, but we've started him on a pain management regimen. He's also doing his physical therapy exercises to help with his mobility.
That's great to hear. Is there anything else I should be aware of?
Yes, he has a history of high blood pressure, so we'll need to keep an eye on that. He'll be staying with us for a few more days to continue his recovery and physical therapy. If you notice any unusual symptoms or complications, please let me know right away.
Of course, doctor. I'll make sure to keep a close eye on him and let you know if anything comes up.
Thank you, nurse. I'll check in on him later today.
Sounds good, doctor. Let me know if there's anything else you need.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Welcome to our show today. We have with us Dr. Craig Morson, who is here to talk to us about asbestosis. Can you please start by telling us, what is asbestosis and how does it develop?
Asbestosis is a chronic lung disease caused by inhaling asbestos fibers. It occurs when the asbestos fibers become lodged in the lungs and cause scarring and inflammation. Over time, this scarring can lead to difficulty breathing, a persistent cough, and other symptoms.
Can you tell us more about how exposure to asbestos leads to asbestosis?
Sure. Asbestos is a naturally occurring mineral that was commonly used in construction and other industries for its heat-resistant properties. When asbestos is disturbed, it releases fibers into the air, which can be inhaled by people nearby. These fibers can become lodged in the lungs, leading to inflammation and scarring over time. The more asbestos fibers a person inhales, and the longer the exposure, the greater the risk of developing asbestosis.
So, moving on to the next topic, what are the symptoms of asbestosis?
The symptoms of asbestosis typically develop gradually over time. They can include shortness of breath, a persistent cough, chest tightness, and a crackling sound when breathing, known as crepitus. Other symptoms can include fatigue, weight loss, and clubbing of the fingers and toes. It's important to note that these symptoms can also be caused by other lung conditions, so a proper diagnosis from a medical professional is necessary.
How is asbestosis diagnosed?
A diagnosis of asbestosis typically begins with a thorough medical history and physical examination. The healthcare provider will likely ask about a patient's work history and exposure to asbestos. Imaging tests such as chest X-ray or CT scan can also be used to detect signs of scarring in the lungs. Lung function tests can also be performed to assess the patient's breathing capacity. In some cases, a biopsy of the lung tissue may be necessary to confirm a diagnosis of asbestosis.
Thank you for that information. Now, let's talk about treatment options for asbestosis. What are the current treatment options available for people with asbestosis?
Unfortunately, there is no cure for asbestosis and the damage to the lungs caused by asbestos fibers is irreversible. The main goal of treatment is to manage symptoms and slow the progression of the disease. Oxygen therapy can help alleviate shortness of breath, and medications such as bronchodilators can help open up the airways and improve breathing. Pulmonary rehabilitation, which includes exercise and breathing techniques, can also be beneficial. In some cases, surgery may be necessary to remove fluid from the lungs or to remove damaged lung tissue.
That's very informative. Can you also tell us how people can protect themselves from asbestos exposure?
The best way to protect yourself from asbestos exposure is to avoid it altogether. This means being aware of the potential for exposure in certain jobs or industries, such as construction, shipbuilding, and asbestos mining, and taking steps to limit or eliminate that exposure. If you suspect that you have been exposed to asbestos, it's important to let your healthcare provider know and to have regular checkups to monitor your lung health. The best way to prevent asbestosis is to avoid exposure to asbestos. This means being aware of the potential for exposure in certain jobs or industries and taking steps to limit or eliminate that exposure. For example, if you work in construction or shipbuilding, it's important to wear appropriate personal protective equipment and to follow proper safety procedures to minimize the risk of inhaling asbestos fibers. If you suspect that you have been exposed to asbestos, it's important to let your healthcare provider know and to have regular checkups to monitor your lung health.
What is the prognosis for people with asbestosis?
The prognosis for people with asbestosis can vary depending on the severity of the disease and the individual's overall health. In general, the earlier the disease is diagnosed, the better the prognosis. However, even with early detection, the damage caused by asbestos fibers is irreversible and the disease can progress over time. In severe cases, asbestosis can lead to lung failure and death.
Are there any long-term health effects associated with asbestosis?
Asbestosis is a serious condition that can lead to long-term health effects. The scarring and inflammation caused by asbestos fibers can make it difficult to breathe and can lead to lung failure. People with asbestosis also have an increased risk of developing lung cancer and mesothelioma, which is a rare and aggressive cancer that affects the lining of the lungs and other organs.
Thank you for that comprehensive information on asbestosis. Now, let's talk about how workers in high-risk industries for asbestos exposure can be protected. What measures can be taken to protect them?
There are several measures that can be taken to protect workers in high-risk industries from asbestos exposure. These include using proper personal protective equipment, such as respirators and protective clothing, implementing strict safety procedures, and providing regular training and education on the risks and proper handling of asbestos. Employers should also conduct regular air monitoring to check for asbestos fibers in the air and make sure that the work environment is safe.
Can you also tell us about the regulations and laws surrounding asbestos exposure?
There are several laws and regulations in place to protect workers and the general public from asbestos exposure. These include the Occupational Safety and Health Act, which sets standards for workplace safety and health, and the Environmental Protection Agency, which regulates the handling, transport, and disposal of asbestos-containing materials. Additionally, many states have their own laws and regulations in place to protect workers and the public from asbestos exposure.
That's very informative. Can you tell us about any ongoing research or new developments related to asbestosis?
There is ongoing research being conducted to better understand the long-term effects of asbestos exposure and to develop new treatments for asbestosis and other asbestos-related diseases. One area of research is looking at new drug therapies that can slow the progression of the disease and improve symptoms. Another area of focus is on developing new diagnostic tools and imaging techniques to detect asbestosis earlier. Additionally, researchers are working to better understand the genetic and environmental factors that may increase a person's risk of developing asbestosis.
That's very interesting. We have covered a lot of important information on asbestosis so far. One more question: how does asbestos exposure affect different population groups?
Asbestos exposure affects different population groups in different ways. People who work in high-risk industries, such as construction, shipbuilding, and asbestos mining, are at a higher risk of exposure and developing asbestosis. People who live near asbestos mines or factories may also be at a higher risk of exposure. Additionally, people who live in older homes or buildings may be at a higher risk of exposure because asbestos was commonly used in construction materials in the past. Furthermore, certain population groups such as smokers and people with pre-existing lung conditions may be at a greater risk of developing lung cancer and mesothelioma when exposed to asbestos.
That's very important information to keep in mind. But, what can be done for those who have already been diagnosed with asbestosis?
For those who have been diagnosed with asbestosis, the best course of action is to work closely with a healthcare professional to manage symptoms and slow the progression of the disease. This may include oxygen therapy to alleviate shortness of breath, bronchodilators to open up the airways and improve breathing, and pulmonary rehabilitation, which includes exercise and breathing techniques. In some cases, surgery may be necessary to remove fluid from the lungs or to remove damaged lung tissue. It's also important for individuals with asbestosis to maintain a healthy lifestyle and follow a healthy diet to prevent other lung-related complications. Additionally, it's important for those with asbestosis to be aware of the increased risk of lung cancer and mesothelioma and to have regular checkups to monitor their lung health.
That's very important information. Can you also tell us about any support groups or resources available for people with asbestosis?
There are many support groups and resources available for people with asbestosis. These include national organizations such as the Asbestos Disease Awareness Organization and the Mesothelioma Applied Research Foundation that provide information, resources, and support for people affected by asbestos-related diseases. Additionally, many hospitals and clinics have support groups and resources for people with asbestosis and their families.
That's very helpful. We have covered a lot of important information about asbestosis so far, but what are some of the misconceptions about asbestosis that people should be aware of?
One misconception is that asbestosis is only caused by asbestos exposure in the workplace. While it is true that people who work in high-risk industries such as construction, shipbuilding, and asbestos mining are at a higher risk of exposure, it's important to remember that asbestos exposure can also occur in the home or community, as asbestos was commonly used in construction materials in the past. Another misconception is that asbestosis only affects older people. While the disease typically takes many years to develop, it can occur at any age, and people who have been exposed to asbestos at a young age are at a higher risk of developing the disease later in life. Also, some people believe that asbestos-related diseases are a thing of the past, but it's important to note that asbestos is still not banned in many countries, and asbestos-related diseases continue to occur today. Lastly, some people think that asbestosis is not serious and that it's just a mild lung condition, but asbestosis can be a serious and life-threatening disease if not diagnosed and treated early, especially in the elderly.
We have covered a lot of important information about asbestosis so far. In conclusion, what message would you like to leave with our listeners about asbestosis?
Asbestosis is a serious and life-threatening disease caused by inhaling asbestos fibers. It can occur at any age and can affect different population groups. The best way to prevent asbestosis is to avoid exposure to asbestos, and for those who have been exposed, it's important to be aware of the symptoms and to have regular checkups to monitor lung health. Treatment options are available to manage symptoms and slow the progression of the disease, but it is essential to raise awareness of the dangers of asbestos and the ongoing efforts to better understand and improve treatment options. It's also important to remember that asbestos-related diseases continue to occur today, and people should be aware of the risks and take steps to protect themselves. Additionally, for those who have already been diagnosed, it's important to know that there are support groups and resources available to help them. So, it's important to raise awareness about this disease and the steps that can be taken to prevent and manage it.
That's very informative. Thank you for joining us today and providing valuable information on asbestosis.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, we will be discussing the overview and classification of the disorder achalasia. Achalasia is a rare esophageal motility disorder that affects the ability of the lower esophageal sphincter to relax and the esophagus to contract properly. This results in difficulty swallowing, chest pain, and regurgitation of food. The exact cause of achalasia is unknown, but it is thought to be related to a problem with the nerve cells in the wall of the esophagus. Achalasia can be classified into three types: type 1, type 2, and type 3, depending on the extent of the abnormality in the lower esophageal sphincter and the esophageal body. Type 1 is the most common and is characterized by an incomplete relaxation of the lower esophageal sphincter and aperistalsis of the esophageal body. Type 2 is characterized by aperistalsis of the esophageal body and hypercontractility of the lower esophageal sphincter. Type 3 is characterized by an incomplete relaxation of the lower esophageal sphincter and hypercontractility of the esophageal body. Achalasia is a chronic disorder that typically presents in middle age, with a slight male predominance. The prevalence of achalasia is estimated at 1 case per 100,000 people. The esophagus is a muscular tube that connects the pharynx to the stomach. It is responsible for propelling food and liquids from the mouth to the stomach by a series of rhythmic contractions called peristalsis. The lower esophageal sphincter is a ring of muscle located at the bottom of the esophagus that acts as a barrier between the esophagus and the stomach. It relaxes to allow food to pass into the stomach and then tightens to prevent stomach contents from flowing back into the esophagus. In achalasia, the nerve cells in the wall of the esophagus, specifically the myenteric plexus, which controls the contraction and relaxation of the lower esophageal sphincter and the esophageal muscles, are affected. This leads to an inability of the lower esophageal sphincter to relax properly and the esophagus to contract effectively, resulting in difficulty swallowing, chest pain, and regurgitation of food. In addition, the failure of the lower esophageal sphincter to relax and the esophagus to contract properly can cause distension of the esophagus, which can lead to dilation and elongation of the esophagus, which can lead to further complications. The most common symptoms of achalasia include difficulty swallowing, chest pain, and regurgitation of food. Difficulty swallowing, also known as dysphagia, can range from mild to severe, and can be accompanied by a feeling of food getting stuck in the chest or throat. Chest pain is typically described as a burning or pressure-like sensation and can be mistaken for heartburn or angina. Regurgitation of food occurs when undigested food and stomach contents are expelled back into the mouth. Diagnosis of achalasia is made through a combination of patient history, physical examination, and various diagnostic tests. The most common diagnostic test is an esophageal manometry, which measures the pressure and muscle contractions of the esophagus. A barium swallow, which is a type of X-ray, can also be used to evaluate the shape and movement of the esophagus. Endoscopy, which is an examination of the inside of the esophagus using a lighted tube, can also be used to diagnose achalasia. The main goal of medical management for achalasia is to relax the lower esophageal sphincter and improve esophageal contractility. This can be achieved through the use of medications that target the smooth muscle of the lower esophageal sphincter and esophagus. One commonly used medication is nitrates, such as isorbide dinitrate and isorbide mononitrate, which work by relaxing the smooth muscle of the lower esophageal sphincter. Calcium channel blockers, such as nifedipine and diltiazem, are also used to relax the lower esophageal sphincter. Botulinum toxin injection, which is injected directly into the lower esophageal sphincter, is also used to relax the muscle. It is important to note that while these medications can help alleviate symptoms, they are not a cure for achalasia and their effects are usually temporary. They may also have potential side effects, and the efficacy and potential risks should be discussed with the patient's physician. Surgical management of achalasia is typically recommended for patients who do not respond to medical therapy, or those with severe symptoms that significantly impact their quality of life. There are several surgical options available, including laparoscopic helemyotomy. This is a minimally invasive procedure that involves cutting the muscle of the lower esophageal sphincter to increase its relaxation. Peroral endoscopic myotomy. This is also a minimally invasive procedure, but it involves cutting the muscle of the lower esophageal sphincter through the mouth rather than through an abdominal incision. Open surgical helemyotomy. This is a traditional open surgery that involves making an incision in the abdomen to access the lower esophageal sphincter. All of these procedures are highly effective in treating achalasia, and most patients experience significant improvement in their symptoms. However, as with any surgery, there are potential risks and complications, such as bleeding, infection, and injury to surrounding organs. Treatment for achalasia has a high success rate, with most patients experiencing significant improvement in their symptoms. Medical therapy can provide symptomatic relief, but its effects are usually temporary. Surgical management is highly effective in treating achalasia, with most patients experiencing significant improvement in their symptoms. However, as with any surgery, there are potential risks and complications. It is important to note that achalasia is a chronic disorder, and long-term follow-up is necessary to monitor for the development of any complications, such as esophageal dilation or Barrett's esophagus. Patients may also need to make lifestyle changes, such as modifying their diet, to manage their symptoms. In conclusion, achalasia is a rare esophageal motility disorder that affects the ability of the lower esophageal sphincter to relax and the esophagus to contract properly. The exact cause of achalasia is unknown, but it is thought to be related to a problem with the nerve cells in the wall of the esophagus. Medical management, surgical management, and lifestyle changes are all effective in managing the symptoms of achalasia and improving the patient's quality of life. Thank you for your attention.
That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the listening test.